Good afternoon, good evening, good morning, wherever you might be. Hello, and welcome back to the 7th Annual International HITLAB Innovators Summit. We're so glad that you can be here with us today for this next presentation. I'm very excited to welcome to the stage now someone who has become a very close friend of mine over the past few months since joining the lab, Dr. Sara Chokshi. Dr. Chokshi is a member of our HITLAB leadership team as the Director of Research Services. In this role, Sara is a primary spokesperson and SME for new research efforts, and also accountable for managing various teams for routine delivery of high-quality results to research and strategy project sponsors. Sara received her Doctor of Public Health, Socio-Medical Sciences from Columbia University Mailman School of Public Health. She is passionately committed to improving the experience of patients, their families, and care providers by applying her expertise as a medical sociologist in healthcare delivery, as well as her knowledge about health information technology, digital medicine, implementation discipline, and user-centered design principles. Thank you so much for joining us here, Sara, and welcome. Thank you for your time.
Thank you, Justin. The feeling is mutual. You are amazing to work with. And I'm really happy to join everyone at the summit. We're sort of almost to our close, and it's been such an amazing experience, as it is every year. But anyway, so Justin, let me know, can you see my screen okay?
Yes, screen looks good.
Okay, very good. Okay, super. So we have about a half an hour, and I will try to not speed through, but go quickly enough to leave time for a little bit of discussion at the end. So what I wanted to talk about today is something, it's more of a think piece for me, something I've been working on in my head and would love this opportunity to share it with you all. I'm going to talk about a new way to think about digital health related research, and I'm calling it the design perspective. So, let's see, sorry, there we go. Okay, so move this up. Okay, so the reason I'm bothering to structure and discuss a new perspective on digital health research is that time and again, I see or run into issues due to this problem. And that problem is all kinds of time and energy and resources are wasted to collect data that in the end doesn't really tell us what we really wanted to know or what we really need to know. And this is the death of a researcher. So this evening I'm proposing a new solution, a little bit of a tool for our research tool belt, if you will. But first, let me just talk a little bit of background and context to set the stage for why I think a perspective tool like this is valuable. I want to start by talking about what we do here with research at HITLAB. Overall, we refer to most of what we do in research, in the research realm, as some sort of verification study. We can debate about choice of words and terms, but I like this one. I think it covers a wide range, a wide spectrum of methods, and definitely the spectrum of methods that we use. But for me, the key sentence in this slide is the last one. And as you can see, as I've circled big in red here, we create studies tailored to your technology's stage of development. And with that statement, you can replace tech with project or program. In my mind, it doesn't really matter. With our work, again, because we're in digital health, a lot of time we're talking about products. I often think in terms of technology-enabled services. So not just focusing on the technology, but thinking about the technology in a more holistic way as combined with implementation and the people who are using it. But as you can see here, the key point is there is method to the madness. It's important to assess and plan carefully for the right research questions at the right time when you're choosing your methods. So listed here at the bottom of the slide are the most common types of research and testing that we often undertake at HITLAB. And each of these has a right time and place in a product or program development lifecycle and can be used in conjunction with one another and at multiple different time points. And so I show you this slide not to sell you on our research services, although I often use this slide to do that. And you can see we have a lot to offer, but to illustrate that there's a lot of important thinking and strategy that goes on before we even get to proposing a project plan or a strategic research portfolio. And I say that pointedly. Another topic I am passionate about is strategy and research, that there's not only strategy to business, but there is strategy to planning your research portfolio in digital health if we're looking to create evidence-based interventions. So anyway, that's for another time, but suffice it to say, there's a need for tools to help improve the kinds of research we see in the digital health space. And I have one that I'd like to share today. Just to illustrate, this slide is a quick overview of the many types of research laid out to, in terms of the individual research methods that are appropriate for different kinds of questions that occur at different time points in a project or a product's life cycle. The categories in dark blue at the top help orient us. And the columns to the left under opportunity are the should or should we bother questions. And if so, who will care? Then comes design. If the opportunity piece says it's worth it, and you should decide to go forward and make a product or make that program or intervention, great. But we still need to figure out the best way to get people able and also willing and hopefully wanting to use it. And then towards the right, we have understanding the impact. And we can see over here on the right that impact-focused approaches is really about, does it address the problem you wanted to solve and how well? So many times startups, for example, come to us and they're like, we need research. We want to do research. And this slide was just to kind of set the stage if I haven't enough already that, you know, it's complicated and we need a simple way to make sure that we're thinking deeply and appropriately about, well, what do we need right now? And what do we need? I think we need a little bit of a new perspective. I call it the design perspective. And what's the word I'm looking for? Spoiler alert, design is an acronym. But for me, this perspective is mental scaffolding. It's a tool to ensure that we're strategically looking at our research design in a way that delivers valuable results. You know, HITLAB is super committed to supporting user-centered, evidence-based digital health and digital health development. So the design perspective is really, that's really what I'm hoping to support with this idea. So again, if we have the issue where we collect all this data, you know, and find out after the fact, oh no, we actually didn't ask the right questions at the right time or the right people, and you know, we have the situation that, again, I said is the death of a researcher. What's the solution? So, you know, in my role as Director of Research Services, I've, like I said, am beginning to codify and train our research staff to use this perspective in all of our research design work. Oops. Okay. So again, and this is part of a strategic approach to research, an approach to ensure that we meet the company or the sponsor and the solution where they are, because part of what we see as our role at the lab is not only executing studies, but helping our companies, our sponsors, our clients understand what they need or what they don't need from a strategic perspective. So hopefully I've convinced you of the need and importance of matching research approach to stage of development. So let me just take a few minutes to take you through what design's all about. So you saw this before, sneak peek. This is, D is for discovery. And discovery is a popular term in terms of digital product development. I don't think that's news to any of you who are involved in digital development. But this concept also works for research generally in pointing out the need to learn about what you have, what you want, and what you need holistically. And I'll add that to that context, where you as a product are in relation to others in your sphere. Do you understand where you are in the world? Who else is there with you? Where do you want to be? What should you do to get there? And what do you know already? We can find out a lot from past work done, from reading, from experience. What don't you know much about? What do you know nothing about but suspect could be important? Do you have a pretty clear idea of your problem and its drivers and the mechanisms leveraged by your product or program to solve it? Do you have hypotheses, or is there a lot of uncertainty there? Do you know who you need to talk to find out this, what you need to know to fill the gaps? This is all stuff of initial discovery, and it's what lays the foundation for a well thought out, well conducted, thorough research project. And that leaves you with, that is what will give you in the end the most valuable learnings. So there's D. Next we have E. E for exploration. Every project should include some exploration, and some research projects may do best by taking a predominantly exploratory approach. I am a qualitative researcher by training. That's my sort of area of expertise, and it's my favorite kind, exploratory research. Sometimes it's seen as sort of a little bit loosey-goosey or fishing around. But I can't impress upon us enough the importance of a thorough exploration phase of research if it's needed, if that knowledge is not there. It is the work that enables you to know the right questions to ask. Sometimes you need to assess where you are and decide if you're ready for confirmatory research, right? Sometimes it's okay not to have a hypothesis. That doesn't mean that your solution shouldn't be. It just means that this exploratory work needs to be done ahead of time to flesh out the foundation that will then enable you to do more confirmatory research, to do that clinical trial, or more what we typically think of as rigorous clinical research. And exploratory research is no less rigorous than any other kind. It's just for a different purpose. So, okay, significance. Discovery and exploration are important and interesting, but key to much of research we do in digital health with its emphasis on engagement is about significance, not in terms of statistical significance, but it is this product or program at a stage where before building and deploying, what do we need? We need to know, does anyone really care about the problem we're looking to address? And we hope the right research can tell you if that answer is yes. People do care about this problem, or a solution or a program is targeting. And this is often an early state assumption that goes untested and really ends up being an expensive mistake. You want to test those very basic assumptions early on. And if you don't hear yes and you hear no, and I'll talk about that in a minute, that's fine too. It doesn't mean the end of story. Another consideration in terms of significance is that you might have a solution that does a great job of solving the intended problem, but if no one really cares, aka no one's willing to pay for it or pay enough for it, then that's a problem. And time and money is well worth it upfront to make sure you're not the only one who thinks this is a problem worth solving in the way that you're looking to solve it. And that brings me to the question of not if the problem is worth solving, but is this how? The problem of solution targets may be important to many, check. But the how the product or program goes about delivering the potential solution could be subpar. So we first think of significance, but also then must understand the I in design, which is implementation. And I know, for example, Guy Efferman spoke earlier in the summit about implementation. But, if something is important, great, you've got a solution to solve it. But I think this is one of the most difficult areas for startups in particular to get a good idea of is implementation, both because they don't think about the sort of where their product fits in the real world and real world healthcare, which is super complex. And I have no doubt I'm not the first one who said that even today, and probably not in the last 2 hours. The other thing about implementation is it's hard on both sides oftentimes to find a partner to study implementation. Hard for startups to find space for testing out their products and sort of figuring out how could this work in the flow, in the workflow, finding sites to be able to do that, and vice versa. At particularly large institutions, it can be hard given the bureaucracy and the structures that that are there for good reason to try out something new. So, but that doesn't let us off the hook. Implementation is so key, and a great solution can fail because implementation was not considered deeply enough and assumptions not tested out. Okay, so a couple more and we can conclude and have some discussion. G is for good guesses. And I'm not sure if you can see this, but it says, no, your guess is not as good as my guess. And that's just to say that, discovery, exploration, significance, as well as implementation are all important pieces of the strategic research puzzle. You need to have thought about what each can bring to your phase of research. Now, G and N, which I'm about to talk to, are key reminders as we move to these later stages of verification research. And like I said, G stands for good guess or good guesses, which I'm using instead of hypotheses, because particularly when working with startups unfamiliar with quote unquote sciencey research, hypothesis can be intimidating, and it doesn't need to be. It means the same thing. When we are ready with our solution and we think we have asked all the right questions to develop a successful tech-enabled service that combines, our technological solution with thoughtful implementation, what's our best guess as to what happens when we pilot? We can also use good guess as a prompt to explore and test assumptions at many points throughout the product or program development lifecycle. So again, G helps us remember to really think clearly and specifically about our hypotheses and what we think our solution will do and what the mechanisms are, and also help us think about and remember to test our assumptions and challenge ourselves. And that brings me to the last letter of our design perspective, which is no is not a problem. And it may not feel that way oftentimes when you're doing research and you get a no and you thought you were hoping for a yes, but sometimes you learn even more when finding or hearing no. I wouldn't use that app. No, I don't need a new tool to track my medication adherence. But what you might learn is what they do need. And so founders and sponsors of research can become so enmeshed in their projects and programs that they are, like we all do, drinking the Kool-Aid a little bit. And particularly in a user research phase, for example, when a potential user says, no, this doesn't work for me, it's received by sponsors not so well. And they say, oh, well, they just didn't get it, and they write that no off. They write those findings off. But it's important to hear those no's and recognize that if your research program is set up well, that not only will you not be afraid to hear those no's, but you'll be ready to take advantage of those no's and squeeze out all the information that those no's have, that are the things that will tell you where you can pivot and where you can take advantage of that information to make your product better, to make it more likely to be used and more likely to solve the problem that you're looking to solve. So takeaways: discovery, exploration, significance, implementation, all very important phases in the research lifecycle that should be thought about. They're big phases, but they're also sort of little cycles within the larger picture of product or program development. And so we always want to think about those. And then G and N, good guesses and no is not a problem, are reminders to us to be clear about our assumptions and rigorous about developing our good guesses, our hypotheses about why we're designing the way we are and what we think is going to happen. And then being ready to hear yes, and also being ready to hear and learn from the no's. So with that, thank you. This is my information. I'm at HITLAB. Feel free to reach out. And Justin, I haven't been paying attention to time, so I hope we have a little time left.
No, we're doing great on time. Thank you again. Absolutely outstanding presentation. I think I'm just going to double check, see if we have any questions from the audience.
Okay.
But I think one thing I'd love to just chat about briefly, and this has just been oh, here we go. I have a question here from Avantika. A question for Dr. Chokshi. How often do you end up asking a question for which the results end up not being as valuable as you would have hoped? If so, do you recycle the collected data and try and ask a new question from it, or start from scratch?
That's a great question. Over the extent of my career, it's happened too often, and that's why I feel like part of what I can offer to the world is a little bit of wisdom there. Even if you ask the wrong question and you don't get what you thought you wanted, of course, you've collected that data, and it's both worth it to see what you can get out of it, as well as, ethically. When you collect data, we are ethically responsible for using that data the best that we can to, forward science, which sounds a little bit heavy, but I take that seriously. So I think it depends on how important it is to still get that information. And in my experience, when this happens the most for me, I'll just give you an illustration. I've been brought into a wider project to develop a product. At one point, there's a decision that some verification research is needed. And so when we start the research, the questions are in one place. But by the time it's finished, the team has sort of moved on and is a little bit more mature in some ways, but has moved on without that foundational research that they were looking for. So I think as early as possible, it helps to to plan. And
Absolutely.
yes, sometimes I've had to go back.
I have one more question here. It's come from Charlie Garland. Thank you, Charlie. At what point do you, as the researcher, push back a bit on the client, testing their assumptions and biases, and asking them for a bigger picture or a larger or a greater perspective? Why are you trying to do this research in the first place? What's your broader context? What are your thoughts?
Yeah, my thoughts are absolutely, I feel like that is what I'm being paid for. It is difficult sometimes. And as I said, people are, they live and breathe their product, their program. And, you try to do it in a way that's non-threatening because it isn't threatening. It's really in the spirit of helping them build the best thing they can be. But I think it is hard sometimes to get sponsors, to get clients to understand that it's really to their benefit to challenge their assumptions and to think big picture. And some people are really appreciative and they want to, they just, it's hard to do. And it really helps to have an outside perspective, with a research lens to help them sort of dig through, those bigger picture things. So.
Outstanding. Well, Sarah, we're at the top of the hour, so I just want to say thank you so much for your time. Really, really
Thank you.
appreciate it. It's been a pleasure to hear you and to learn more about what the research department's up to from the marketing perspective over here.
Great.
Well.